So I think we have a graphic where we can show our viewers, and let's walk through them.
Sure.
The first one is saline.
Saline.
Is that the most popular?
It used to be, but not anymore. So saline implants were reapproved back in 2006 for cosmetic use. Up until then, silicone implants. Up until then, saline were the most common implants done. But now about 90% of the implants that we do are silicone.
And why so, if I can ask?
Silicone gives you a more natural look and feel. They actually feel more like your own breast tissue. Saline implants have a couple of bad sides. Number one is that they can have rippling. Rippling is where you can actually see ripples form on the side of the breast, which is not very attractive. So to prevent that, most surgeons will overfill their saline implants because the more pressure in the implant, the less chance for rippling, but then it feels hard. So now it feels like you just have a hard round ball in the breast. Okay. They also have the highest rupture rates and also the highest rate of capsular contracture, which I'm sure we're going to also be talking about, which is a long-term complication of breast augmentation.
And what about gummy bear? I've never heard of that one.
So gummy bears are a type of silicone implant. They are still in the silicone family of implants. They are just a much more cohesive gel, meaning like if you're cooking a sauce on your stove, the longer you let the sauce cook, the thicker it gets. And that's basically what it is. It's a very, very thick silicone that's not like a watery gel. If you cut it in half, you know, I have half an implant and half an implant. It's not like I cut it and then oozing out of the gel.
So of those 3 implants that we just saw, do you decide what you're going to put inside? Or is it just protocol to go with the silicone at this point?
Well, it's a team effort. I always involve the patient in the decision-making process. We choose together, but I give my recommendations, and I let them know the data, because there are people that still have some fears that are not really based on data with silicone. So I explain it to them, and most patients are you know, obviously understand that I am going to choose what I think is best for them, you know, not just for the result, but also, of course, for their health, which is the most important thing.